All right, and welcome back to another information sharing webinar brought to you by the First Nations Public Service Secretariat. My name is Selena Dorme. I'm from the Tsleil-Waututh Nation here in North Vancouver and the engagement coordinator for the FNPSS. For today's webinar, we have Indigenous Services Canada here to provide some information relating to Indigenous Community Support Fund, the Emergency Management Assistance Program, the Income Assistance Program, and some reporting requirements that there's been some changes made to those. We also have Shannon McDonald from the First Nations Health Authority. Thank you so much for joining us. Our speaker today from Indigenous Services Canada is the Regional Director General for the ISK-BC region, Catherine Lapa. Thank you for joining us. And I'm going to go ahead and hand it over to Catherine to speak for a few minutes, and then over to Shannon McDonald, and then we can go ahead and get started with the Q&A.
So good morning, everyone, and thanks, Selena, and thanks to the First Nations Public Service Secretariat for being such an amazing partner in hosting these webinars and coming up with a platform that allows us to reach communities in real time. I want to start by acknowledging that I am fortunate to be from my home on the traditional and unceded territory of the Squamish here in North Vancouver, and assume many of you are equally trying to make home offices work as best as possible in your communities. So my thanks also to Dr. Shannon McDonald, who some of you will see on the screen there, who will also be joining us today. And my thanks to all of you in communities for your leadership and collaboration. It is incredible how wide-sweeping the impact has been in such a short amount of time. And the fact that there is still no confirmed cases in First Nations communities is testimony to the tremendous leadership, collaboration, and preparedness that your communities have undertaken. We know that there's a lot of questions here today, and so I'm going to start with a few comments to deal with some of the key themes that have been coming up as we move forward. So as you're probably aware, we are working closely not just with the First Nations Health Authority, but with Emergency Management BC and other partners to ensure that this process is as seamless as possible for you and to ensure that no door is the wrong door as you have questions and look for pathways for information, funding, and how to access supplies, equipment, food, and various other things. Last week, many of your administrators participated in a webinar that Chief George Wilson and Bill Guerin, our Associate RDG, had to address some of the top of mind issues with regards to questions such as income assistance, emergency funding, support for band operations, and national funding supports. But a week is a long time in this situation, and much has happened since then. So it's great that we can have ongoing dialogue so that we can answer your questions as we move forward. On the line as well, so if you guys stump me with questions, Bill Guerin, the Associate RDG, Angela McCarthy, our Acting Director of Funding Services, and Wendy Rogers, our Director of Programs and Partnership, are all on the line. And I can assure you, in our region, we have been working flat out to try and respond to communities as best as possible. Today, I had the figure of about 1,000 calls and emails that we're getting on a daily basis. So we are doing our best to get back to communities in real time, but I hope you appreciate that those are pretty overwhelming numbers. And so if we can get you collective information through webinars like this, hopefully we can address your questions as best possible. So as you will see, the Prime Minister has been doing daily press conferences and making announcements, and we are all trying to catch up in terms of figuring out the details of these various announcements. So let me try and unpack a few of them for you. On March 18th, he announced that there would be $305 million available under the COVID-19 Economic Response Plan for Indigenous communities. $215 million of that was dedicated for on-reserve so for First Nations and self-governing communities. $15 million is being set aside for regional, urban, and off-reserve Indigenous organizations, and $10 million is for emergency family violence prevention shelters on reserve to support women and children fleeing violence. There's an additional $40 million for shelters off reserve as well, being managed by another department. Last weekend, we sent every community in BC a letter which identified how much you would be receiving from the Indigenous Community Support Fund to give communities the ability to fund according to your priorities and needs. This is in addition to the advances we sent out at the end of fiscal year to every community for both social assistance and emergency management. The allocation of the funding within the 305, how that was split, was discussed between the national Indigenous organizations. In total, 40 million of the 215 million going to First Nations is going to BC First Nations and self-governing nations. And I'll just outline some examples of the expenses that would fit under the terms and conditions. And I do want to note as well that the terms and conditions of this are under our emergency management program, but they are in fact being expanded to recognize that there needs to be flexibility and adaptability to the needs as they're arising. But it is intended for things such as increased transportation costs within and outside of communities for community members who can no longer use public transportation, goods for community members who are in preventative isolation or quarantine, support for elders, food and nutritional assistance, community care packages, support and learning packages for children, assistance for essential workers without childcare, assistance applying for government supports, Canada Child Benefit, and so on. And I'll come back to that in a moment. The funding is there to, as I said, to provide flexibility to ensure First Nations can address the specific needs immediately. But I would strongly recommend, and that's why we also have Shannon on the phone, that if you have health-related services, products, resources, equipment that you need, that you discuss that with FNHA, so that your allocation under the Indigenous Community Support Fund is going specifically to non-health related functions, and you maximize the breadth of funds that are available for BC First Nations, as the First Nations Health Authority will be getting separate resources. Although the fund is based on reserve numbers, I will answer the much asked question that yes, it can also support off-reserve members, particularly those returning on reserve who may not normally be on your counts. However, I would also emphasize that all the other economic measures and income supplements that the Government of Canada is announcing each and every day, such as the Enhanced Employment Insurance Benefits, the Canada Emergency Response Benefit, the Canada Child Benefit, the GST credits, support to businesses, and the list goes on, are available to all First Nations on and off reserve. And so it would be important that you look to assisting community members to navigate those rather than trying to replace those benefits on reserve. As you are aware, we have put reporting requirements on hold and streamlined processes such as allowing for e-approvals for agreements. We would like to get your feedback on what else we can do to make this easier for you during this situation. I am later today meeting with colleagues from other federal departments also to see how we can better coordinate outreach and communications products for the benefits that I listed, as we can appreciate that in many cases, First Nations are unrepresented in some initiatives such as the Canada Child Benefit, as people have a hesitation to file their income tax. But truly there are hundreds of dollars available when people in fact apply for these programs. We are also, I just wanted to flag mirroring provincial enhancements. So we are watching closely the announcements made by the provincial government. So recent announcements such as the increases to social assistance, persons with disability, and halting the aging out provisions for children in care. We will mirror all of these on reserve as well. So to come back to the $15 million that's available for urban and off-reserve Indigenous organizations, those will be accessed through a nationally run proposal-based process. The $10 million for shelters, for on-reserve shelters, will be supplemented with $40 million through Women and Gender Equality off-reserve. And the Prime Minister today announced an additional $100 million for food banks and other food access for communities across the country. I would like to thank you for joining us and welcome your questions, and we'll maybe now turn it over to Dr. McDonald to speak to some of FNHA's efforts in this regard, and we are privileged to continue our collaboration with FNHA throughout this crisis. So thank you very much.
Thanks, Catherine, and I'm apologizing ahead of time. I got the invitation to do this on a bit short notice, so I have to leave at about 1:30, and I thank you for your tolerance of that. And I'm calling in today from Sayut First Nation, where I live as a guest, and I'm proud to do so. COVID has created huge challenges for individuals in our communities, no matter where they live. It's a challenge to their wellness, their families, their communities. Isolation is not the way most Indigenous families and communities live and work. And a lot of our work has been focused on the structural response and the public health response, but we also want to recognize at the individual level that there is no immunity to this particular disease, and Therefore, there's a lot of anxiety and fear about what it might do to individuals and their families. There could be financial stress. There's certainly social stress. We hear quite often of communities and families who want to participate in cultural practices and protocols, but how do you do that in the context of physical distancing? We know that individuals and communities, mental health, spiritual health, emotional health are being impacted as well. Nonetheless, to do everything we can, we are all hands on deck. First Nations Health Authority has had an emergency response team, a public health response team in place since mid-January. And that has elevated in its response from a level 1, which assumes that most things can be handled at a community level, to a level 3, which helps us to understand that about 80% of our work as an organization is going to be focused on the COVID response, understanding that the other 20% are still the essential services that people continue to need. We're partnering with the provincial health officer, with regional medical officers of health, with regional health authorities, our provincial partners in many ministries, and of course, our federal partners, especially at Indigenous Services Canada, and working together to support and respond to concerns that are raised by communities. We are particularly interested in access to culturally safe care and personal safety. You may have noticed if you're on our website that there's been a discussion in the last couple of days about when it's not safe to be at home and what kinds of things might be needed for individuals to be away from home during a time when social distancing and isolation are the standard protocol. We also hear about individuals, as Catherine said, who have a desire to move back to community because they feel safer than they do in their urban environments or others. But at the same time, communities are locking down and asking people not to come home because of the risk they feel from outside. So we are working with communities and individuals, supporting the needs for isolation, if that's being requested of people when they return home, or if people have become ill and need to be out of the house. We're working with our health benefits department to make sure that we can support that. So in addition to working on the prevention of COVID disease in community and the transmission within community, we want to make sure that healthcare is available at the right care is available at the right time and in the right place. So that has meant some policy changes around things like health benefits, medical supplies, and prescriptions, and our primary care partnership work as well. So continuing to do work in all of those spheres and responding to what the communities have asked us to do, and continue to work in partnership. Hello. This is a lovely young lady. The only company I've got is my dogs. So thank you for your time, and I will stay as long as I can to listen to the response, and then we'll have to head off, but I'm sure that we will get emails with questions if that's something you wish to do. So thank you.
Thank you, Dr. McDonald. Appreciate it.
And it works fine.
All right, so we have some questions that have been submitted so far, so we're going to go ahead and move into that. The first question is about tribal councils and their eligibility to receive emergency benefits that are COVID related.
So thanks for that question. It's certainly one that's been high on my mind as well. So as I mentioned, the funding allocations and the approaches taken have been worked out in extremely tight timelines. And so there were discussions at the national level with the AFN and the other national organizations. And it was very much felt that it needed to be the full allocation of the 215 million needed to go to First Nations communities. So in the speed of doing those allocations, I'm not aware of whether or not there were discussions about the roles of tribal councils, but in fact, the whole $215 million is being allocated fully out to Indian Act bands, self-governing and treaty nations. So at this point in time, we do not have separate allocations for tribal councils, but I can assure my friends in the tribal council that I have been raising this numerous times at the national level, that if there's another wave of funding or various other pieces, we should be considering how we could support tribal councils in these efforts as well.
Thank you. Next question is, well, thank you for hosting the session. Is ISK working with OGDs and the Indigenous partners to respond to food security needs that are affected by COVID-19?
Yeah, so I didn't touch on food security earlier, but it is certainly a recurring issue. So there's different ways of looking at the food security issue. One is what is available in communities so that they can continue to purchase food according to their regular patterns. And so we are plugged in with Emergency Management BC and provincial ministries who are looking at the supply chain, not just of food, but other supplies, medical equipment, and various other necessities for across the province. And through that, we have the opportunity to identify where there might be some specific issues for Indigenous communities. The province is very clear that they consider every community in BC to be a priority. So they do not see that First Nations communities as being a federal responsibility. But clearly, we have a concern to want to ensure that particularly those that might be isolated or affected by transportation network changes are supported in their needs. The other piece is that the allocations that communities have allow for the flexibility to purchase food, whether for elders or other vulnerable populations, for cultural functions, whatever cultural purposes, whatever the case may be. So there is some flexibility to do that, and we're certainly happy to work with you if there are distribution issues that are coming up. The third issue that comes up when we talk about food security is access to traditional foods. And so the challenge around whether or not hunting is possible during these times and getting the appropriate permits in some cases, and then also around fisheries. So I am meeting this afternoon with all federal departments, as I mentioned, and I did want to have a discussion with Fisheries and Oceans following a discussion we had with the First Nations Leadership Council yesterday. And I wanted to acknowledge that there are a number of First Nations Leadership Council members on the phone, and they deliberately chose to dial in, but to listen so that there would be more time for questions. But I do think we need to have some further conversations with Fisheries and Oceans around access to food, social and ceremonial. So we will absolutely be doing that as well. We have a small team dedicated to reaching out to communities. We're working closely with FNHA, for instance, who often get worried about where there might be challenges, to try and identify how we can assist where there might be some true supply issues. As we all know, we're all experiencing shortages in key areas all across the province, and we will work with communities to see what we can do to ensure that needs are being met.
Great, thank you so much. The next question, how many other First Nations have identified that the funding, which is based on the 2016 census, is insufficient? I state this as our community reviewed our allocation and have identified that the numbers are well below what we have, at least by 200 members.
Sorry, I'm just trying to unmute myself. I might turn it to Bill, who might have a bit more information on this, but essentially there was, as I say, in the Prime Minister's words, speed was chosen over perfection in some of these enterprises, and so the methodology was used based on 2016 information. But we need to realize that it wasn't so much a per person allocation, but really allocations between communities. So everyone will have been affected by the 2016 numbers being inadequate. And it was really just in order to divide out the 215 million pot across. So we appreciate that there are some deficiencies in it, but the intent was to get money out as quickly as possible. And we will work closely with communities. And if in fact the crisis continues for a length of time, or the pressures continue to mount, please stay in touch with us, as we will certainly advocate for additional resources as the situation unfolds. Bill, did you want to add anything from the information you were able to get from calls yesterday?
Thanks, Catherine. No, unfortunately, I wasn't able to get any additional information. We do have some staff working to go back to the source data to see what we can determine based on the source data. But again, I would urge anybody that has specific concerns to get hold of us so that we can look into it individually.
Great. Thank you, Bill. The next question is for Shannon, actually. Can the 2019-2020 First Nations Health Authority funding be carried forward to 2020-2021?
Oh, you're asking the wrong person. Unfortunately, my colleague, Sonia Isaacman, was supposed to be on the call, and I'm here in her stead, and she's much more aware of such things. So rather than make an error, I'm going to suggest that question be sent to her at the office or through your community engagement coordinators, and we will get that response back publicly more broadly so that everybody gets the answer.
Thank you. The next question is, we have a number of Indigenous citizens who are homeless throughout the province. There seems to be a lack of communication to shelters, portals, and other supports for the homeless population. Out of the 305 million planning to take place to address circumstances where shelters place the homeless in close proximity to each other, it is an overwhelming issue to address, but I'm curious if there's an update that we could relay in our respective communities.
So Shannon and I were both just on a call with a number of provincial ministers speaking to a lot of the urban Indigenous service providers, including shelters and so on. And certainly it's both a priority of the federal and provincial government to provide enhanced funding and to ensure that prevention measures are taking place in these facilities, and that there's also outreach to the most vulnerable populations. So as I already outlined, there is $10 million going to shelters on reserve, 40 million from the federal government off reserve. That is in addition to the province putting in additional funding. And as I indicated, the Prime Minister just announced additional resources for food banks and various other organizations. So there are efforts underway on that. And I don't know if Shannon wanted to add to that piece at all, but I know it is a real priority to get to people that otherwise might not be getting the messages about what's happening out there and need urgent support during this situation.
As Catherine said, the call we were on included multi-ministry, several ministers were on the call, and there is actually a cross-government in BC response and a vulnerable populations working group that are working very hard on pulling together all of those sources. Our representation is, we have a shared position with the Provincial Health Officer's Office, Dr. Danielle Bain-Smith, and she has been leading that work on our behalf. So it's hard to say how that's drilled down so far. Some of the conversations are relatively high level, but the influx of money has certainly helped to bring those conversations to ground and hopefully help people at a more individual level.
Great, thank you. The next question is, I understand that this funding is identified as Indigenous Community Support Fund. So my question is this specific to COVID-19, or are we expected when the freshet occurs and there are floods already occurring to also utilize this in that event as well?
So thanks for that question. So the funding, both the year-end funding that we send out for emergency management and increases in social assistance, as well as the what we're calling the Indigenous Community Support Fund, are specific to COVID-19. We recognize, and both FNHA and ourselves are trying to prepare ourselves now for the fact that we are reaching both flooding season and then shortly thereafter wildfire season. There would be separate resources identified to deal with those emergencies.
Yeah, our emergency response team, one that started out in January, have branched off to include freshet and wildfires. We've actually identified 2 fires in the interior already. So it's something that we're going to be dealing with, and planning is happening accordingly.
Great. Thank you so much. Another question for Catherine. We received our year-end emergency funding and one for the new fiscal year. Is this a one-time deal, or will the government be reviewing in the future?
So thank you. I think that question might have been from Adams Lake, if I saw from the questions rolling down. So at this point in time, we don't know for certain. The allocation that is going to be sent out in the 2020-21 funding agreements is intended for the fiscal year, but we all recognize that it is highly uncertain as to the length of this unrolling. Some people are indicating that it would, potentially last till the summer with the potential of another wave in the fall. So certainly the government will be revisiting its forecasts and expectations along with how the situation unfolds. So I can't make commitments that there will be funds coming, but I can indicate that as the Prime Minister and ministers have indicated, that this will be continued to be reviewed as we move forward. And in fact, if any of you are watching the daily news, the Prime Minister is out there virtually every single day making new announcements. So I think we have to stay tuned on that. And I would encourage you to let us know how those funds are going and what your needs are, because we try to anticipate what some of those pressure points might be, but certainly staying in touch with us and letting us know if there are unique circumstances in your community or how things are impacting your communities is helpful for us to pre-position the need for additional resources should they be required.
Great, thank you.
I just want to pass on my apologies. I'm going to have to leave the call. Thank you for your time, and I will look forward to hearing from people soon.
Thank you, Dr. McDonald. Nice to have you on here today. Appreciate it. Sorry, I'm just going to stop her video. There we go. This next question is one of the biggest questions we received since doing the past few webinars is some clarity around the money that's rolling into First Nation communities. Is it also to support off-reserve community members?
So as I indicated in my opening remarks, the funds are based on your on-reserve numbers and are largely under the current terms and conditions of the Emergency Management Program, which means that they are intended for on-reserve expenditures. However, we are expanding the terms and conditions and realize that every situation is different. And so if there are off-reserve needs that the community identifies and wants to fund out of that allocation, it will be under that same allocation base. So really it's up to communities to balance out those various pressures. The reason I outlined all the programs that are available, no, I didn't outline all of them. I outlined some of the programs that are available in the broader Government of Canada plan, is that I would encourage communities to be familiar with what other resources and supports are out there, both from the provincial and federal programs, because it would be unfortunate to duplicate existing programs and services that members off reserve or on reserve could access with the funding that you've received from Indigenous Services Canada, because it will come at the expense of other priorities in terms of pandemic preparedness and planning that you might otherwise have. So I would encourage you, and we have, I think, with the invitation to this included a 2-pager, which gives websites and information on what other programs are available so that communities also access those. And as I've identified a few times already, there are enhancements to service providers for urban Indigenous people in communities across the country that are being provided as well to ensure that not just at the individual level, but at the service provision level, that there are resources available to deal with this impact. And as I indicated as well, we are mirroring, for instance, the social assistance increases. So the fact that the province identified yesterday a $300 a month increase for the next 3 months for social assistance will provide off-reserve members on social assistance additional supports. The Canada Emergency Response Benefit of about $2,000 a month is available, as are EI enhancements and other programs.
Great, thank you. Can you provide an update on fiscal year-end policy at this time? Was it extended? How are you supporting First Nations with year-end reporting?
Thanks for that question. And I hope that most people on the line are getting our daily update. I'm going to put my public service announcement out there that every day I've been writing to chiefs and councils across the country. And we are using that update as well for our funding service officers to get into communities. And if there are some on the line that aren't getting them and want to be on the list, please let us know. So we have indicated that we have put year-end reporting requirements on hold during this crisis. So there will be no holdbacks and no impacts if you can't, in fact, get your reports in by the regular deadlines. We have also tried to simplify other administrative processes, recognizing that it's hard to get in-person chief and councils to get signatures on on funding agreements and amendments. So we are doing those electronically. And if there are other administrative pieces like that that you think that we should be paying attention to, we're more than happy to. But absolutely, we are cognizant of the fact that as communities have closed their band offices and are functioning on essential services, that we need to be working with you in lockstep to make it as simple and streamlined as possible.
Great, thank you. Next question is, as schools on and off reserve develop continuity of learning plans, is ISC prepared to provide more support to connectivity or hardware when required? Communities are doing inventory surveys on connectivity and devices right now.
Yeah, so thanks for that question. And I don't know if Wendy will want to jump in and add more to it, but we are working very closely with the First Nations Education Steering Committee for kids going to on-reserve schools to make sure that they have the supports and resources necessary to be able to continue with their learning as their school outlines. For those going to off-reserve schools, I know as I'm getting the notices from my daughter's schools that they are really trying to survey what tools and resources are available to those students and to try and provide things like laptops or other supports as necessary. On the connectivity piece in particular, I don't have a specific answer on that, but I know that it is a priority, and we'll work with FNESC and other partners to make sure that First Nation students are set up for success as they continue to try and complete their school years in very challenging situations for all of us. You guys have seen my daughter popping in. You know, I was trying to tell her that she couldn't make popcorn in the middle of this webinar. These are not, you know, easy circumstances for kids who are used to being in a structured environment at this point in time. And FNESC is also, you know, working with partners to see what other supports could be provided for kids at risk who are otherwise, you know, able to get meals programs and various other pieces. So we are aware of the various challenges and trying to put appropriate supports and flexibilities in place so that that kids can, and in fact, be supported. I might say a little off script here as well that we have noticed, mostly it's the case across the country, that requests for Jordan's Principle have in fact gone down during this period. And that is largely attributable to the fact that many service providers, occupational therapists, speech therapists, various others are not able to operate at this point in time. But we also recognize that this period may create other vulnerabilities. So between whether it's our Child and Family Services program, where we are enhancing supports as well for kids in care for things like connectivity and various requirements that they may have, but also for other kids. So please, if you don't know which stream to go, call us at ISC, and we'll try and help you work through it because we recognize that this is putting a whole range of, you know, mental health pressures as well as others on kids across the province.
Great, thank you. The question is about on-reserve social assistance. With the announcement yesterday from the province about extra payments to IA clients, SA clients are asking if they will receive this as well. I'm assuming that if we decide to do so, it will come out of the initial emergency funding for IA and or further emergency funding we receive.
Yeah, absolutely. The reason we put out the initial supplement at the year end for IA was a recognition that the province was already enhancing some benefits for hardship and emergency assistance. So we wanted to make sure that communities felt that they had the resources to immediately mirror those on reserve. We have been working closely with the provincial ministry and are aware, and we're aware of the increase that has just been announced, and we'll be mirroring it. So there will be further increases to social assistance budgets commensurate with those provincial increases. So please, you know, if you don't have the resources available, reach out to us. But we would expect that you are that you would mirror these as quickly as possible to deal with the immediate pressures that that individuals are facing. Wendy, did you want to pop in on that one? I see you.
Yeah, I just wanted to add that that we have confirmed that because it's a crisis supplement, that it will be equally available to those in block and those in new fiscal relationship.
Right. So those in block and 10-year grants, that those will be above and beyond what you currently have in your allocations. Okay, so that's an important detail that Wendy is outlining, that these are one of those exceptional circumstances that that those in block and 10-year grant would get in addition to their annual allocations.
Great, thank you. Who do we contact to access funding for violence against women, supports to assist women fleeing violence during this time?
Well, as I indicated, we're not the frontline service provider on that one, so we would be providing additional funding for women's shelters and so on. But I think that those are all at the local level. So Wendy, any suggestion on who they should be contacting? I mean, I presume at the local community level, you'd be in a better position to identify what to do in those circumstances.
So as Catherine said, we have provided an increase to shelters who I think in some cases have increased the number of available beds that, that there are, but certainly if there are additional needs, you could just contact our main, I think we have a COVID number that we can contact, or certainly you can contact me directly and I can pass you along, and I think you can get my contact information from I think the First Nations Public Service Secretariat is going to have information online, I presume, and so we can provide my contact information as well as the COVID-19 line if you have additional questions.
Yes, we can definitely do that. The next question is, we have a new community hall and it was sanitized in anticipation of having to isolate community members that may have symptoms and need to be removed from their crowded homes to protect other people in their home. Will the emergency funds assist us in acquiring equipment, supplies to house those members in the hall if needed?
So thank you for that. Those are the types of questions that I would suggest that you you get in contact with the First Nations Health Authority on. Both the First Nations Health Authority and ourselves have sent out community guides in terms of what eligible expenses are, both under our emergency management funding or the Indigenous Community Support Fund on our side, but also on their side for health related costs. So they have been reaching out to communities to identify what the costs might be with regards to setting up isolation or quarantine situations, and would be in a better position to assist. So we can try and get the name of who asked that question and connect them with the appropriate people in FNHA, as they'll be better to advise what are the protocols. They are finalizing isolation protocols, and then also ensure that, and this is again a situation where they have separate funding from us. So rather than using the Indigenous Community Support funding that you'll be receiving, it would be advisable to work with FNHA and get resources on their side to support you in those community-based efforts.
Thank you. Transport Canada, yesterday afternoon, they made some announcements about restricting boat traffic carrying 13 people or more. Recreational and First Nation fishers are not affected, though First Nations have concerns of sporties aggregating boat launches or coming into First Nation communities via waterways. Anything you can share on that?
Yeah, this is kind of out of my normal wheelhouse. We were advised of those measures, and as I said, I'm going to be talking to other federal departments this afternoon, so I can ask a little bit more about it. I think the same protocols about not asking people to come to your communities apply here, and we can sort of find out a little bit more around it. The idea behind that, though, is that if there are essential services that are being provided by vessels that are more than 13, that those will be on the list. So just to assure people who may be concerned about those limitations, that we have been developing a list that will be fed back to Transport Canada to ensure that, you know, for instance, smaller taxi or ferry services to community that are providing supplies and so on are deemed to be essential and not affected by this.
Thank you. This next question is, it needs to be clarified just where funds are coming from when councils are providing money to their members. Members of community I work with are assuming that we received a huge pot of cash and are now demanding their portion. This is a challenging one. It comes down to good communication from the leadership level within the community, but anything else you can add to that?
Yeah, so as I identified on the onset, the money that was provided under emergency management funding, social assistance, and now the Indigenous Community Support Fund were not seen to be benefit packages for individuals. There are other streams that are there to deal with the impacts for the self-employed, those on EI, those on social assistance, and various other pieces. The funding that was provided to communities was really to enhance the resilience and preparedness of communities to address with the collective needs that you may have. So setting up emergency operations centers, dealing with the incremental costs of transporting goods into your community, trying to ensure that vulnerable populations that may no longer get group-based services, like I keep thinking about, you know, whether there's like elders supports and events that would normally take place and no longer are able to in these circumstances, that those funds are there to sort of support those that counted on those collective approaches. And that if individuals who can access other government programs really should be assisted in trying to navigate those. And so again, the community funding that we're sending out, for instance, could also be there to set up some sessions with community members to help them navigate those, to set up their accounts and so on. I tweeted the other day, there's a CRA video that's supposed to be quite simple to help set up a CRA account. So that you can file a tax form so that you can access Canada Child Benefit and the GST credits, for instance. So there could be some resources like that put into place so that that community members are able to access the same benefits as other Canadians. And I would recommend some approaches like that. As I said, I'm meeting with federal departments this afternoon because I realize, we all realize, and we've been told by ministers to work effectively in trying to ensure that there is reach out to people that are not otherwise accessing these programs. So we're going to be discussing how best to do some of those, given that we can't be in-person outreach, but are there other ways of reaching some of those individuals who otherwise have not been accessing the benefits that are broadly available.
Mm-hmm. Great, thank you. We are just at about a little bit over 45 minutes. I do believe that Indigenous Services Canada has committed to following up on any questions that were not answered live. We can pull a report of everything that was submitted during this time. Catherine and her team will be happy to follow up with those people individually. We have your contact information. Anything else you want to add, Catherine, before we close out?
Just to say, like, I'm sorry that there are many that were not able to get into this call. It does show that there's a great demand for it. So and I think the poll that Selena was trying to do at the onset was to really see what your needs are going forward in terms of whether this is the most appropriate platform, how often you'd like to get information, and so on. I have indicated that we are sending out daily updates. We've had our funding service officers reach out to every community. We are tracking the number of communities that are working on essential services only, like where band offices have closed, where there's states of emergency that have been brought into place, if there are bylaws being passed, whether emergency operation centers are being set up, and so on. So please keep that information coming to us, as we are keeping track of it, and many others are interested in this information. Again, no door is the wrong door, whether to us, FNHA, or others, and within ISK as well. If you have a relationship with a capital management officer or with a funding service officer, or want to give me, Bill, or any of our directors a call, we've circulated those numbers, our cell phone numbers, on many occasions. Please just reach out and ask us the questions, send us the feedback. Again, my thanks and appreciation for all the efforts that are taking place. I'll end where I started, which is the fact that there are no confirmed cases so far in First Nations communities is amazing. We need to keep up those efforts and keep working together on that to try and keep your communities safe as best as possible. So my thanks to all of you for those tremendous efforts, and hope that we can continue on with this collaboration.
Thanks so much, Catherine. I really appreciate you being here today. I know the information was really useful. Like I said, we plan to continue to do these weekly. I want to do some forward planning, at least to give you a schedule for the next month on what types of webinars are going to be put out. I do also want to mention the First Nation Administrators Network Facebook page that we have too as well. All those members on that Facebook page are individuals that work in communities. So your administrators, your executive directors. It's another platform for information sharing. So post a question question there. Maybe somebody has an answer. They've done it before and they can help. So thank you so much. And apologies for not everybody being able to watch. We'll get that fixed the next time around, where we're definitely over 100 people. So we'll try to fix that bug next time. Thanks again, and be safe and healthy. Thank you so much. Bye-bye.
Bye, everybody. Have a good weekend.